water, and sleep.
Oh wait, that's my protein.
Okay. So this has a little bit more detail on it than the other one does, but it's similar, and we can use both on the exam. But you know now, somewhere along the middle here, you draw a line. You have your right side and your left side, and you can see these little raised areas. That's where the auricles are. So, where is the blood coming into this part? Here and here. I mean, no.
Yeah.
Oh,
Superior.
sorry.
The inferior vena cava, superior vena cava, brings blood to the right atrium and auricle. Okay? Now, the model that we had, the other heart, had, I think, a little bit of this, but, you know, this goes into, has a lot more vessels than the brown heart. And these veins match up with, not perfectly, with those arteries we were discussing that come off of the aorta. Alright, so these are draining blood. This is draining blood from the head and neck region, this one, and this one. And this is draining blood from your right and left arms, coming back here to the superior vena cava. Right? You notice, like, all vessels, arteries, and veins are kind of paired because one brings the blood to the area and one then returns the blood back to the heart. So it's not 100% accurate, but they're paired. And whatever the name of the artery is, many times it's the same name of the vein. But again, not 100%, but very close. So when we do the vessels, we're going to spend a lot of time talking about arteries. Most of the veins follow similar names. We'll point out the differences. But remember, this was the aorta, and we had the brachiocephalic trunk on the right side, but none on the left side. So here's the brachiocephalic trunk, and then that's going to bifurcate here into the right common carotid, and here to the right subclavian. And then there's other little branches coming off of that. This is the brachiocephalic vein, just accepting blood from the right subclavian vein and the jugular vein. So it has a slightly different name here, jugular. It's not called the carotid vein. And that's the right brachiocephalic vein going in there. Now, we didn't have a brachiocephalic trunk on the left side, just went directly to the left common carotid and the left subclavian. But we do have a brachiocephalic vein on the left, so left and right brachiocephalic veins leading into the superior vena cava. And then there's your jugular, and there's your subclavian vein leading into that. From here, you want more information?
Sure.
Okay. From the atrium, it's going to pass through the valve. Which one is this? Tricuspid. Okay, or atrioventricular. It has 3 cusps. These are little what? Cords, known as the chordae tendineae. And now, we don't really see them connected like we did on the other one. If we close this, right, there's your papillaries, right there. Okay? Now, notice that the inner chamber, right, that's the ridged muscular wall, trabeculae carnae is the ridges. And it's all covered in a lining, an epithelial lining known as the endothelium. So this is the muscle, and it's ridged, and the ridges are called the trabeculae carnae. And then we could say the white, the covering the lining of the heart and the lining of the blood vessels, which is made up of a simple squamous epithelial cell, is known as the endothelium. Right? It passes from here to here. This muscular wall contracts, and it's going to be forced out on its way to the lungs, and it's going to hit the first semilunar valve. Right? And you can see the top view of it, and you can see the bottom view of it. This is the pulmonary semilunar valve, it's on the way to the lungs, and it's leading to the pulmonary trunk, which is then going to bifurcate. Here's one branch going to the left side, and then here's the other branch, the pulmonary arteries, right and left. Goes to the lungs, gets oxygenated, and then has to return. Right? It returns through here and here, the pulmonary veins, the right pulmonary veins, left pulmonary veins, and they dump into this zone, which is the left atrium and auricle. That muscular wall is going to contract, force it through this valve. This is the left atrioventricular or bicuspid or mitral valve, and enter into the left ventricle. Same idea. Chordae tendineae, papillary muscles, trabeculae coronae, endothelial lining, thick muscular wall. This is known as the septum. Right? The interventricular septum between the two ventricles, a big, thick muscle that separates the two. I think they talk about something, they're probably labeling it here, number 108, and it's, I guess, on the ground, is it called something the moderator band? It's a little thick piece of muscle that just kind of controls the, contraction of this, so it doesn't expand too much or contract too much. I mean, it's a moderator type muscle. It's a muscle that helps monitor the contraction. I think they point that out. Okay. And then this guy will contract, and it will squeeze blood. Here we go, deep in here. That's the passageway. Right there's your other semilunar valve. That's the aortic semilunar. You see it there, and you see the top of it there. They're the pulmonary and the aortic are right behind one another. And that's on its way out to the body parts, coming up through, is the beginning of it, ascending aorta, arch of the aorta, descending aorta, and then it's going to go into your branches that we discussed. And then some other things that are on here. The yellow stuff is fat. These yellow lines represent nerves, cardiac accelerator nerves, parasympathetic vagus nerves that regulate the heart rhythm. The green stuff, this is lymphatics, lymph nodes and lymphatic vessels. The trachea. This one has both trachea and esophagus. No, that's your esophagus behind the trachea. These are your primary bronchi. These are the first two branches going to the lungs. So the other two components to discuss are the vessels, the coronary vessels that perfuse and supply the heart, and what we call the conduction system. The conduction system is special neurological tissue built into the heart that regulate the contraction. Okay. Alrighty. So take a couple minutes to review this.